All right. I am having some internet issues. I hope that you guys can hear me. Megan, am I good to go?
I can hear you, Suzette.
Okay, great.
Go.
My internet's a little unstable today. All right. So we'll just dive into our topic today. Um, first of all, I thought it would be helpful for us to just sort of talk about where the word comes from, the word stigma. And in ancient Greece, they called stigmata these marks or brands that they burned into the skins of criminals, traitors, enslaved people that made sure that everybody knew that they were less than, that they were separate from other people, and they were pretty much shunned, especially in public places. So it was a way to identify those people. And so over time, the word stigma, coming from the word stigmata, has been used to describe this state of being socially discredited or disgraced. And most importantly, it sets somebody apart from the other people in society. So that's where the word comes from. But, human beings are very, very good at creating us versus them and creating in groups and out groups. That's just sort of human nature. And so, sociologically speaking, an in group is a social group that a person psychologically identifies with as being a member of that group. And an out group is a group that the person does identify with. And so we have lots and lots of layers and levels of these in groups and out groups and us versus them. And it can be something as simple as, like, if you're in high school and you don't have the right
We just had Suzette's audio drop out. We'll give her one more moment to reconnect here, everybody.
tennis shoes, of people as being in or out, or us versus them. But there are some of these concepts which start to extend societally. And so these out groups in society start to get stigmatized. And some examples, this is by no means a comprehensive list, but some examples are people with mental health conditions. Mental health conditions are not well understood. And, we say, oh, that person's crazy. That's stigmatization. So things like contagious diseases can cause people to get stigmatized. The perfect example is saying, oh, he's treating me like a leper. Or another good example, unfortunately, is people with HIV, especially back in the 80s, early on, when we didn't understand as much about HIV. Those folks were really stigmatized and really seen as the other, and they were avoided and shunned, unfortunately. And over time, I think that's gotten better, which is an example of how the concept of stigma, as it's focused on individual groups, can change over time. But I think that is a really good example. Also, people who are disfigured. All over the world, people who have disfigurements tend to hide, and other people tend to be uncomfortable being around them. And then the last example that we have here of a stigmatized group is people who have cognitive impairment. And again, it's because it's not well understood. Most of these that are stigmatized, that comes from a place of other people just not really understanding what the nature of their condition is. And when you don't understand something well, that makes us as humans fearful. And this fear, I think, is sort of underneath a lot of the stigmatization that we see. So let's talk specifically about stigma around cognitive impairment or dementia. And again, as I mentioned earlier, this stigma is really similar to the stigma that's associated with mental health, because some people really do not understand the delineation between, a mental health condition and memory loss. Underneath both of those things are disorders of the brain, but people are just not well informed about that. They don't understand that all of these conditions are physical conditions. Underlying these conditions are disorders of the brain. Another reason that cognitive carries with it often a certain amount of stigma is that the majority of people who have dementia or cognitive impairment are older. And we also in this country, unfortunately, have a bit of some stigma, some preconceived notions, some bias, perhaps, around older people, around elderly people. And so that compounds the stigmatization of this group. And it's also accentuated by a lack of medicines. We do have some medications which are approved.
See, bear with us as we get Suzette's internet connecting here.
By the FDA that decline, but it does slow down the symptoms. And we heard in the webinar done at Brain Talk Live today about another drug that is on the market now and approved. But by and large, there's not a lot that you can do about progressive degenerative neuro conditions. And so that's a real barrier to people understanding how folks can live with a diagnosis. And then this next to the bullet, I think, is one of the most important bullets. The stigma that we see is often because other people assume that a person who is very early in this process is more impaired than they actually are. Once they hear that somebody has a diagnosis, they automatically think of somebody being in a much later stage than they actually are. When in reality, somebody with MCI, as Megan said, is basically still pretty much independent in their day-to-day lives. They just have some mild cognitive challenges. And so that lack of understanding about how this condition can be really mild in the early stages contributes greatly, I think, to the stigma. Another thing that contributes is that the depictions that we see in movies and television shows and media in general, the depictions of dementia are often very inaccurate, and they tend to focus on folks who are more advanced. And I think we don't see enough depictions of folks who are early on in this process. So that's another contributor. So because there is this stigma association, almost 1 in 4 people with dementia hide or conceal their diagnosis, and they say that stigma is the main reason for that. So almost 25% don't want to let other people know that they've gotten this diagnosis. And 35% of caregivers said that they've hidden the diagnosis from a family member or from others. So, and that's more than a third. So it tells you how powerful this stigma is. Really distressing that we still have such a strong stigma around this, because the scope of this problem is so worldwide. We've got 50 million people living with dementia, and every 3 seconds somebody in the world develops dementia. And that's expected to more than triple by the middle of this century to 152 million people. That's really significant. In the US, our statistics are there are more than 6 million people. And here are some shocking stats that a lot of people don't know. 1 in 3 seniors dies with Alzheimer's or a related dementia, not necessarily, but with it. And Alzheimer's disease kills more people than breast cancer and prostate cancer combined. So it's the 6th leading cause of death in the United States and the fifth leading cause for people 65 and older. So with that, prevalence of a condition, we'd be further along in our understanding of it and our attitudes towards it. But unfortunately, we're not there yet. And not that includes among healthcare professionals. Unless someone in the healthcare field has specific training about Alzheimer's and related dementias or about mild cognitive impairment, it's sometimes really shocking to me what they don't know. And that's a real barrier moving forward into getting treatment, finding a cure, and in dealing with the societal implications of this condition. And I think this quote really sums it up here. Stigma stems from fear. Fear breeds silence, which in turn perpetuates ignorance and misunderstanding. So this next couple of slides comes from the Alzheimer's Association. They talk about some examples of ways that you might experience stigma if your loved one has a diagnosis of some kind of cognitive impairment. Sometimes your friendships are tested. For some people, draw closer and you receive support that you really did not even expect. But the opposite can happen. Friends can either be in denial about your diagnosis and just kind of refuse to believe it. And sometimes they'll withdraw because it's just awkward and they don't really know how to respond. Or they can really hold you at arm's length. And that sometimes leaves people feeling very abandoned. And we know that many people with a diagnosis report that they feel somewhat isolated after a diagnosis for a lot of reasons. And isolation is just anathema to health and happiness, important negative side effect of this. Another example is that not just with your friends, but your relationships with your family can change. Your very closest family members might be in denial. They don't want to talk about it. They also assume that you're not as able to do as many things as you actually can. They might want to try to take responsibilities or tasks away from you that you're still capable of doing. And they might have misperceptions in that area. So I think one of the things that is most important within families and also with very close friends with these relationships is to really try to maintain open lines of communication. You want to let them know, how you feel about what you can do, and you want to listen to them about what they're observing about your abilities as well. But those open lines of communication really, I think it's the number one thing that helps maintain and strengthen relationships in situations when one has a diagnosis. Another is that, and some of you may have noticed this, that when somebody else knows that someone has a diagnosis, they might not address them directly as much anymore. They might approach the care partner instead of the person with the diagnosis. And this happens a lot of times when you go to healthcare appointments. The doctor, the healthcare provider might talk to the care partner instead of to the person with a diagnosis when they're still perfectly capable of answering questions. And so when the person is present, it's okay to talk to that person. The care partner, if they're there, can also be a part of that conversation, exclude the person with the diagnosis. But that is a very common way that stigma bubbles up. and actually presents itself to people. And then finally, the reaction of some friends and family to the diagnosis sometimes prevents the person or their care partners from seeking support from others that they might have asked. And so building a support team is really, really important for folks who have mild cognitive impairment, early dementia. If you build a team around yourself early, you're much, much better positioned to deal with changes and to receive help and support from others going forward. If you wait until things are more advanced, it's more difficult to sort of pull that team together for a lot of reasons. And so this stigma can keep people from asking for help, even though for most of us, it's not really so much in our nature to ask others for help. But even if you're not asking people, to do tasks for you, you can still ask them just support, to give you a call, maybe to give you a lift to a club, book club, if you're not driving anymore. It doesn't have to be something where you're asking your friends to do really heavy lifting for you. But again, I did want to just talk a bit about why this conversation is so important, not just for individuals, but on a larger societal level. On a personal level, stigma is the single biggest barrier to improving what your life looks like with dementia. It prevents you from doing all of those things that we've talked about. Some of those things we've talked about, like developing a support system, getting a diagnosis in the first place. It just really can keep you from going on a path that allows you to continue to have good quality of life. We'll talk a little bit more about what that looks like in a minute. Stigma can also undermine goals and participation in meaningful life activities. And as a result, of course, lower levels of well-being and quality of life. And then at a broader level, looking at our society, this stigma, this structural stigma and the discrimination that results from it can influence the kind of resources that we have available to us, the kind of care that's available to us. And one of the ways that happens is that resources and support systems don't get funded as much. The squeaky wheels get funded, and because there is a stigma around talking about cognitive impairments, the squeaky wheel historically hasn't gotten as much funding. So this has gone up, but we still have a long way to go in being fully funded, like some of the other major health issues are. So this is another graphic from the Alzheimer's Association. These are very specific things that are affected by stigma. So people might not want to get medical treatment when they notice initially maybe that they're having some memory problems. You want to lay it off to stress or to just getting older, to normal aging, when it's really better, much better, to go ahead and talk to your healthcare provider about symptoms as soon as you notice them, because it really might be something like that, or some kind of physical condition that could be treated. So the stigma, though, prevents people from going ahead and talking to their healthcare professionals about that. And when you don't talk to your healthcare professional, that prevents you from getting an early diagnosis or any diagnosis. About 50% of people with dementia don't have a diagnosis, are not seeking a diagnosis. And that's a real issue because there are so many benefits of getting diagnosed early. Even though it's a hard diagnosis to hear and receive, there are so many things that you can put in place to make your journey going forward, to make this road that you're on, this new road, make it better.
And Suzette, I'll just interrupt to say that today at the Lukimbi Town Hall, they talked a lot about how a lot of these new medications that are coming out, you can only receive them with an early diagnosis. That if you don't catch that diagnosis early and you wait till later, you may not qualify for some of these new treatments that are coming out very recently.
Yes, absolutely. That's an excellent point, Megan. Thank you. And all of these things really are designed to, again, make your trajectory, make your journey as good and as fulfilling as it possibly can be. And one of the things that you can do early on to make things down the road easier is to put in place your plans for the future. To make sure you've done your advanced planning and that you have your advanced directive for healthcare, and that you've let maybe your financial advisor know, or your lawyer, or people in your life who really are affected by this and can help you make decisions going forward. What are the best things to put in place to deal with this? So that part of planning for the future, if you don't get an early diagnosis, and you're trying to do this down the road, it's so much harder. You want to make plans when you can still be an active participant in that process and make sure that you let people know what you want for your future. All of us should be doing that, but especially when you get a diagnosis, you want to make sure that all your ducks are in a row. And then, of course, Megan just talked about benefiting from available treatments, and this other one, participating in clinical trials. Many times those trials are limited to folks who are early in the process, and other resources like the Cognitive Empowerment Program. Our program is designed for people with mild cognitive impairment. And so you want to take advantage of the things that are there while you're able. And they're also not just CEP, the program and CEP Community Live, but the Alzheimer's Association has early stage programs and support groups. So there are things out there that you can take advantage of. And we've also talked about how the lack of public awareness about this condition negatively impacts the funding for research and for support and resources. So the good news is there are some efforts worldwide to sort of try to destigmatize and support people with dementia. And the United States is lagging behind a couple of countries. The Netherlands is one of them, and another country that is leading, I think, the United States in these efforts is Japan. But Japan has the highest proportion of people over 65 in the world. They have the fastest most rapidly growing aging population in the world. And so a few years ago, they launched a national strategy for dementia, which in this country, we also have the National Alzheimer's Plan. But Japan has taken it, I think, to a slightly different level. So their strategy tries to create a whole society where people who have cognitive impairment are looked at differently, and the people who have a diagnosis, they want them to have a more positive outlook after the diagnosis. So they promote coexistence amongst people who don't have a diagnosis and who do have a diagnosis. And they also focus greatly on prevention and early detection and early treatment. There's one initiative that I find might have some memory loss or cognitive impairment. And that makes people feel more comfortable, I think, about interacting with others, and just creates a more comfortable community for everybody. So I love programs like that. And then the city of Kobe in Japan is the first city there to, they actually passed this municipal order. It's an ordinance designated city to be a dementia-friendly community. And so they also do a lot of training for people in the community and for caregivers. So I think that going forward, the U.S. will look at the positive outcomes from these kinds of initiatives and see the benefits, and hopefully adopt more of these kind of programs in the United States. And I'm going to tell you in just a second about how you might be part of that effort to adopt programs like that here. But first, I just wanted to share with you some tips. These, again, are from the Alzheimer's Association about what you can do to overcome stigma. And this first one is to just be open and direct. Engage others in discussions about Alzheimer's and the need for prevention, treatment, and a cure. And that goes for not just for folks who are affected, but by people just in everyday life. Even if you don't have a diagnosis or know of someone, you can be a part of the conversation. Now, I want to say that I'm very respectful of each person's decision about who to tell about a diagnosis and when to tell. But I think the less stigma that we create, the easier it is to be open and direct. It's sort of cyclical. The more open we are, the less stigma, and the less stigma, the more willing we are to be open about it. But I do think that it's, for most people who've had the experience of being open with others about their diagnosis, by and large, they've had very positive experiences with that. And it just adds to the whole societal climate about being more comfortable with this physical brain disorder. And then number two is communicate the facts. And again, we find over and over again that the lack of information and lack of education about a medical condition is one of the most important aspects of stigma. And so if you can point people to, if you can tell them about it, great. Or if you want to give them written information or point them to a website, especially those who are close to you, the better they understand the condition, the more comfortable they'll feel with you, and the more likely they'll be to be in your circle and your on your support team. And there are lots of different ways to communicate the facts. The Alzheimer's Association has great resources, and they'll actually send you printed materials for free. And their website is really good too. But there's the National Institutes of Health and the CDC. There are tons and tons of written materials that you can provide people with in the process of communicating the facts to them. Is seek support and stay connected. We've already talked about how important it is to stay connected to other people and engaged in meaningful relationships and activities. And, you know, I think that's one of the things that the people in the Cognitive Empowerment Program most often report to us, is that the thing that they found the most helpful about it was this opportunity to be supported by the people in the program, by the staff, by the information that they get, and by the connections that they form, the relationships that they build with other people in the program. It's so important. Number 4 is don't be discouraged if other people in your life are in denial or keeping you at arm's length. That is not a reflection of you. It's a reflection of them. And if you encounter people who think that Alzheimer's is just normal aging, look at that as an opportunity to educate them otherwise. And then finally, be part of the solution. People who have a diagnosis are the most powerful advocates for change. You can help raise awareness, fight stigma, and also advocate for more Alzheimer's support and research. And there are many ways to do that, but I wanted to tell you that I really do believe that the Alzheimer's Association has one of the best advocacy programs that there is. This is a link here, but if you just Google Advocate Alzheimer's Association or call this number, they will set you up to be an advocate. And the beauty of it is that you can be involved to the degree that you feel comfortable with. You can just send emails, and they'll send you a and the email template might say, please increase funding for this Alzheimer's initiative. You can also change the template and add your own story, but you can just send emails, or you can visit your state representatives. You can visit your local, your federal representatives as a part of a team that the Alzheimer's Association will build around you and help you figure out how to do that. And then you can also be a champion and really get involved in, you go to Washington, D.C. every year and meet at the Capitol or in the Senate building, the representative buildings with your legislators, and tell them your personal story. And there's nothing more powerful than that. So I want you to think about the possibility of becoming an advocate, even if it's just at that level of sending a few emails. It's just a couple of clicks and they'll get you set up with how to do it. It's really easy. All right, so that is the bulk of the presentation, but I did want to see if you guys had any questions for me.
And we did put the link to the Alzheimer's Association website, how to become an advocate, into the chat for those of you who are curious. I will say, we have a lot of people who come into the program after a diagnosis and really have that moment of, what do I do now? And a lot of times that can affect something we talk about here at CEP a lot, our meaning and purpose in our lives. Suzette, can you speak a little bit to how when we overcome stigma ourselves, it can help us connect more to meaning and purpose after a diagnosis?
Yeah, sure, Megan. So, during the presentation, I alluded to this concept of being on this different road that you didn't expect. When you get a diagnosis, you think you're on a pretty predictable path. And then you get a diagnosis and you go off on this very unexpected path. And the degree to which you try to maintain purpose and meaning on that new path is really important to how well you're going to cope with the diagnosis and how well you're going to do emotionally. So stigma can prevent you from reaching out and really being intentional about saying, how do I make this new road the best that it can be? I'm on this new road, but there are things that I can do to make sure that I have a reason to get up every day. I can do things that nourish me emotionally, spiritually, and give me joy. And again, unless you really do that intentionally and make it a priority, sometimes it falls by the wayside. And stigma is one of the things that can prevent that from happening, because if you're feeling like you don't want to engage with other people, that really prevents you from living your best life with this.
Thank you, Suzette. And one other question. This is something that has come up a little bit in our own program here at the Cognitive Empowerment Program. You may be a care partner that's thinking, yeah, these things are great, but my partner, even after a diagnosis, has been unable to acknowledge or even accept what is happening in our lives with clarity or with a meaningfulness. Can you speak a little bit to some of your advice when that is the case, when there might be a little bit of something we refer to from time to time as denial happening at the same time?
Yes, sure. I think, first of all, Megan, I want to make a distinction between denial, which is a normal human reaction. It's a defense mechanism that prevents us from being sort of psychologically injured. Sometimes this information is just too much to process, and that's normal and often persists for a while, and then people move more towards acceptance of whatever the diagnosis is. And then there's another thing entirely, which is called anosognosia. And that is a condition where, because of the changes that are going on in the brain, the person is really not able to understand or comprehend or be aware that they have impairments. And it's very difficult for somebody whose brain won't allow them to process this information to sort of get on the same page as others who might see the impairments. And so for people who just have some denial, I think that the most important thing is to recognize that if you try to yank people out of denial too fast or too hard, you can really pull them into depression. And so you have to be sensitive and sort of diplomatic and delicate sometimes with people, and just make sure that they're safe and everything is, you've put things in place that enable them to go on with their day-to-day lives. But, just make sure that you communicate really well with each other, like I talked about before, and ask the other person to be open to your observations of what they're seeing, and be in the journey with them, and be willing to, if there's something that the person enjoys doing, maybe you can do it together. Or maybe there's somebody in the family that they really enjoy doing things with that can kind of be on your support team. And also, I do want to say that there is no one size fits all solution to this, because this is a tough one. And so I think it's super helpful to talk to a social worker, people who are seen in the cognitive neurology clinic at Emory have access to social workers who are wonderful, or there are also counselors in the community who have some experience with these conditions, and they can really help guide you through your own personal situation and give you some suggestions and kind of a plan for how you move forward.
Thank you, Suzette. It's so helpful to have all these reminders, especially because sometimes after a diagnosis in a family of mild cognitive impairment or memory loss, you can be stuck feeling like I'm the only one or no one could possibly understand. And it's so beautiful to be able to connect with other people who have that same experience, with people who are experts in the field and can guide your expectations and the tools in your toolbox along the way. And I love the reminder that you gave everybody that connecting with a social worker or counselor is a really great way. Someone who specializes in memory loss and maybe works for a neurology clinic here at Emory, that it is a wonderful way to have someone that you can unpack these questions with a little bit further, especially if they have been really kind of dominating your thoughts or your daily life. So please reach out to your social workers or to us here at Emory. We put some information in the chat for those of you who want to connect more with the Cognitive Empowerment Program. And otherwise, Suzette, thank you so much for your expertise this week. We'll post the video to our YouTube channel later on today. And thank you everybody for dropping in and attending and for all your great feedback as well.
Thanks, everyone.
All right, we'll see you all next Wednesday, September the 6th at 2 p.m. You will be getting that email today with all of the updated information about our new schedule in the next 15 to 30 minutes. So thank you all, and we'll see you next week.